why seniors need to be careful with their nut consumption. Nuts are often hailed as a healthy snack, rich in fats, proteins, and essential nutrients. However, as we age, our bodies respond differently to food, and what was once a healthy choice may no longer be the best option. In fact, many seniors unknowingly eat nuts that, over time, can contribute to inflammation, muscle breakdown, cholesterol imbalances, and other health issues. The challenge is that some of these nuts are marketed as heart-healthy, keto-approved, or packed with healthy fats. Yet, these very nuts can secretly harm the body, particularly when consumed in excess. But fear not, in today's video, I'll help you navigate through the nuts that you should avoid and, more importantly, introduce you to the healthier alternatives that can genuinely support your body as you age. 1. Bitter almonds, a silent toxic danger. Bitter almonds are often mistaken for regular almonds, but they are much more dangerous. The reason lies in the compound amygdalin found in these almonds, which, when digested, is converted into cyanide, a toxic substance. Cyanide interferes with the body's ability to use oxygen, and this is where the problem begins. The dangers of cyanide. Even a small number of bitter almonds, 4 or 5 raw ones, can cause symptoms like dizziness, nausea, and confusion. If consumed in larger quantities, more than 10 almonds, it could lead to more severe reactions requiring medical intervention. Seniors are especially vulnerable to cyanide toxicity because as we age, our ability to detoxify harmful substances weakens. What you should know about raw bitter almonds. While regular almonds are safe and packed with nutrition, bitter almonds are often marketed as health aids or detox solutions, which is misleading and dangerous. Despite their appearance as natural and harmless, raw bitter almonds should be completely avoided by seniors. Cooking or processing bitter almonds destroys the toxins, but consuming them raw, especially in large amounts, poses a significant health risk. I've encountered many seniors who were recommended bitter almonds or apricot kernels as a natural detox aid by so-called health gurus. This advice can be life-threatening, as I once had to rush a patient to the emergency room after he consumed raw bitter almonds thinking they would help with his health. His confusion and dizziness were clear signs of cyanide poisoning, which luckily was treated in time. The lesson here, always be cautious of health claims that don't have scientific backing. 2. Peanuts, the hidden danger in your snack drawer. Peanuts, often consumed as an easy snack, are not true nuts. They belong to the legume family and grow underground, which makes them particularly vulnerable to contamination by a mold known as aspergillus, which produces aflatoxins. These toxins can cause serious health problems over time. Aflatoxins and their effects. Aflatoxins are powerful carcinogens, linked to liver damage, weakened immune function, and an increased risk of certain cancers. The elderly, whose bodies may not detoxify these harmful substances as effectively, are particularly vulnerable. So, even though peanuts might not have caused issues in the past, they could now contribute to hidden liver stress and low-grade inflammation that compromises overall health. Omega-6 fatty acids, a double-edged sword. Peanuts are also packed with omega-6 fatty acids, which, although essential for health, can promote inflammation when consumed in excess. This imbalance between omega-6 and omega-3 fatty acids can lead to joint pain, sluggish circulation, and cognitive decline, all of which are concerns for seniors. In my years of working with seniors, I've often seen them eat peanuts without realizing the potential long-term consequences. One of my patients, an older gentleman with a history of high blood pressure, was snacking on peanuts daily. After I helped him switch to healthier options like almonds, his blood pressure started stabilizing. It's a reminder that even seemingly harmless foods like peanuts can have a bigger impact on our health as we age. 3. Macadamia nuts, the fatty culprit for muscle loss. Macadamia nuts are widely loved for their rich flavor and creamy texture, but they come with a hidden downside. These nuts are incredibly high in fat but low in protein and fiber, which makes them less suitable for seniors who need to maintain muscle strength and support recovery. Low protein and fiber. For older adults, maintaining muscle mass is crucial, as muscle loss is one of the main causes of frailty and reduced mobility. The high-fat content in macadamia nuts does not compensate for the lack of protein and fiber, essential nutrients for rebuilding tissue and supporting muscle health. Without adequate protein, seniors can experience slower recovery times after physical activity and increased vulnerability to weakness. The risk of weight gain. Additionally, macadamia nuts are calorie-dense, which can lead to weight gain if consumed in large quantities. This extra weight puts additional pressure on aging joints, exacerbating issues like arthritis and decreasing overall mobility. In my clinical experience, I've had patients tell me they feel more fatigued and weak despite eating what they thought was a healthy diet. After reviewing their snacks, I noticed many of them were consuming macadamia nuts in large quantities. Once they swapped them for nuts with more protein, such as almonds or walnuts, their energy and muscle strength improved. 4. Pine nuts, a hidden medication interferer. Pine nuts are small, refined, and seem harmless, but for seniors, they can be surprisingly dangerous. Pine nuts contain a compound called pinolenic acid, which can interfere with the liver's ability to process certain medications, such as blood pressure meds, cholesterol-lowering statins, and drugs for heart rhythm. Medication interactions and risks. When pine nuts interfere with medications, it can cause dangerous spikes in blood pressure, irregular heartbeats, or unexpected clotting issues. This is particularly concerning for seniors who may be managing multiple prescriptions. Additionally, pine nuts are high in polyunsaturated fats, which oxidize quickly and release damaging compounds that can contribute to cognitive decline, joint pain, and clogged arteries. Another peculiar side effect of pine nuts is pine mouth, a condition where a person experiences a persistent metallic or bitter taste after consuming them. This can last for days or even weeks and significantly affect seniors' appetite, which in turn can lead to weight loss, muscle weakness, and slower recovery times after illness or injury. I once had a patient who started eating pine nuts frequently because of their supposed health benefits. After a few weeks, she reported a strange, metallic taste that lasted for days and diminished her appetite. Once we removed pine nuts from her diet, her taste returned to normal, and she regained her appetite. It was an eye-opening experience of how even seemingly innocent foods can cause unexpected complications. 5. Cashews, the bone breakers. Cashews are often thought of as a luxurious, heart-healthy treat, but for seniors, they can pose several risks, especially for bone health. Cashews are high in oxalates, which can interfere with calcium absorption and contribute to weaker bones. The oxalate problem. Oxalates are compounds that bind to calcium in the digestive tract and prevent it from being absorbed by the body. This can lead to calcium deficiencies, which are a major concern for seniors at risk of osteoporosis. Without enough calcium in the bones, the risk of fractures and falls increases, which can significantly impact mobility and quality of life. Blood sugar spikes. Cashews also contain more carbohydrates than most nuts, which can cause blood sugar spikes. For seniors with diabetes or those at risk of developing diabetes, this can be particularly problematic. Consistent blood sugar spikes can damage small blood vessels, especially in the legs and feet, leading to poor circulation, slow-healing wounds, and nerve damage. In my practice, I've had several patients report problems with their bones and joints while eating cashews regularly. One senior patient, who struggled with osteoporosis, was surprised to learn that his frequent consumption of cashews may have been contributing to his calcium issues. After we cut back on cashews and added more calcium-rich foods, he noticed an improvement in his bone health. The healthier alternatives. Now that we've covered the harmful nuts, let's talk about the healthier options for seniors that can actually support your overall health and longevity. 1. Chestnuts, the nutrient-rich superfood. Chestnuts are often overlooked when it comes to nuts, but they are one of the most nutrient-dense options available, especially for seniors. Unlike most other nuts, chestnuts are low in fat and high in fiber, making them a great choice for older adults who need to manage their weight and support digestion. Low in fat, high in complex carbohydrates. One of the standout features of chestnuts is their relatively low fat content compared to other nuts. This makes them a great alternative for seniors who are conscious about calorie intake or who are trying to avoid weight gain. Chestnuts are packed with complex carbohydrates, which provide steady, long-lasting energy without causing the blood sugar spikes that can happen with refined carbs. For older adults, maintaining healthy weight is crucial for reducing the risk of joint pain, diabetes, and heart disease. Chestnuts offer a filling snack that won't weigh you down, making them an ideal choice for seniors managing their weight. Rich in vitamin C and antioxidants. What truly sets chestnuts apart is their impressive vitamin C content. Most nuts are not significant sources of vitamin C, but chestnuts contain a healthy amount, which is essential for immune function, skin health, and collagen production. This vitamin helps strengthen the immune system, which tends to weaken with age, making seniors more vulnerable to infections. Chestnuts are also loaded with antioxidants, which help reduce inflammation and oxidative stress. These antioxidants, including flavonoids and polyphenol, are critical in protecting the body from free radical damage, which can accelerate aging and increase the risk of chronic diseases such as heart disease and cancer. Promotes healthy blood sugar levels. One of the most important benefits of chestnuts is their ability to regulate blood sugar levels. This is crucial for seniors, especially those managing diabetes or prediabetes. Chestnuts have a low glycemic index, which means they do not cause rapid spikes in blood sugar levels. The high fiber content also helps slow down the absorption of sugar, ensuring a more stable release of energy throughout the day. For seniors with diabetes, maintaining steady blood sugar is key to avoiding complications such as nerve damage, kidney issues, and poor circulation. Versatility and easy to incorporate. Chestnuts are incredibly versatile and can be used in a variety of ways. Roasting them makes for a delicious snack, and you can also grind them into flour to use in gluten-free baking or as a flour substitute in pancakes, muffins, and bread. They can be added to salads, soups, and stews for added texture and nutrients. I've personally found chestnuts to be a great addition to my senior patients' diets. One patient, who was struggling with digestive issues and fluctuating blood sugar levels, began adding chestnuts to his meals. Not only did his blood sugar stabilize, but he also reported feeling more energized and less bloated. Chestnuts are an excellent way to improve digestive health while also providing a nutritious, low-fat energy source. 7. Almonds, the all-rounder for bone and heart health. Almonds are widely regarded as one of the healthiest nuts due to their exceptional nutrient profile. For seniors, almonds provide a wide range of health benefits, particularly for bone health, heart health, and brain function. Supporting bone health. As we age, maintaining bone density is crucial to avoid osteoporosis and fractures. Almonds are an excellent source of calcium, a vital nutrient for maintaining strong bones. Additionally, almonds are rich in magnesium, which plays a crucial role in regulating calcium levels and ensuring that calcium is deposited into the bones rather than the arteries. This combination of calcium and magnesium makes almonds one of the best foods for bone health. Seniors who consume almonds regularly may experience improved bone density, reducing the risk of fractures and falls. The presence of vitamin E in almonds also helps protect against oxidative stress, which can contribute to bone degradation. Heart health and cholesterol control. Almonds are packed with monounsaturated fats, which are heart-healthy fats that help lower LDL cholesterol levels and reduce inflammation. This is particularly important for seniors, as heart disease becomes a more significant concern with age. By lowering LDL cholesterol and promoting healthy circulation, almonds help protect the heart from the damage caused by high cholesterol and poor blood flow. The fiber in almonds also helps lower cholesterol levels. In addition, the antioxidant properties of vitamin E help protect the heart from oxidative damage, supporting overall cardiovascular health. Brain health and cognitive function. Almonds are a great source of vitamin E, which is a powerful antioxidant that helps protect brain cells from oxidative damage. Vitamin E has been shown to support cognitive function and may reduce the risk of cognitive decline and diseases such as Alzheimer's. By consuming almonds regularly, seniors can help maintain their memory, focus, and mental clarity. Almonds are also rich in riboflavin and L-carnitine, two compounds that are essential for brain function. Studies have suggested that these compounds may help improve memory retention and cognitive performance, which is especially important for seniors looking to maintain mental acuity. Muscle health and protein. In addition to bone and heart health, almonds are an excellent source of plant-based protein, which is essential for muscle maintenance. As we age, muscle mass tends to decline, and this can lead to frailty and weakness. Including almonds in the diet can help provide the protein necessary to maintain muscle strength and prevent muscle loss. Almonds are one of the most balanced nuts in terms of health benefits. I often recommend them to my patients as a staple in their diet. One patient, in particular, who had struggled with memory loss, started eating almonds daily as part of her breakfast. After a few months, she reported improvements in her concentration and mental clarity, which highlights the significant impact that small dietary changes can have. 8. Walnuts, the brain-boosting nut. Walnuts are often called brain food due to their high content of omega-3 fatty acids and antioxidants. These powerful nutrients provide significant benefits for cognitive function, memory, and overall brain health in seniors. Omega-3 fatty acids for cognitive function. Walnuts are one of the richest sources of ALA, alpha-linolenic acid, a type of omega-3 fatty acid that is essential for maintaining brain function. Omega-3s help keep brain cells flexible and healthy, which is critical for memory, focus, and coordination as we age. Research has shown that omega-3 fatty acids can help protect the brain from age-related decline and neurodegenerative diseases like Alzheimer's. Seniors who consume walnuts regularly may experience improvements in cognitive function, memory retention, and processing speed. The omega-3s in walnuts also support overall brain structure and help maintain mental clarity. Antioxidants for brain protection. In addition to omega-3s, walnuts are rich in antioxidants like polyphenol, which help protect the brain from oxidative stress. Oxidative stress can damage brain cells and accelerate cognitive decline, but the antioxidants in walnuts help neutralize free radicals and reduce this damage. These antioxidants can cross the blood-brain barrier, offering direct protection to neurons and preserving brain health. Improved blood flow and circulation. Walnuts also contain arginine, an amino acid that supports healthy blood flow. Good circulation is essential for brain health, as it ensures that the brain receives enough oxygen and nutrients. By improving blood flow, walnuts help maintain brain function, memory, and mental clarity. Supporting sleep and mood. Walnuts contain melatonin, a hormone that regulates the sleep-wake cycle. Seniors often struggle with sleep disturbances, which can negatively affect mood, energy levels, and cognitive function. By consuming walnuts, seniors may experience improved sleep quality, which contributes to better overall health and well-being. I've seen firsthand the benefits of walnuts for seniors. One of my patients, a woman in her 70s, reported that she had trouble remembering things and had trouble sleeping at night. After adding walnuts to her diet, she noticed improved memory and better sleep quality, which made a huge difference in her overall mood and energy levels. Walnuts are truly a powerhouse for the brain. 9. Brazil nuts, thyroid and hormonal health. Brazil nuts are nutrient-dense and contain a wealth of minerals, including selenium, which plays a vital role in thyroid health, metabolism, and overall energy levels. Let's explore the unique benefits of Brazil nuts for seniors. Selenium for thyroid health. Brazil nuts are one of the richest sources of selenium, a mineral that is essential for the proper functioning of the thyroid. The thyroid gland regulates metabolism, energy levels, and muscle function. Selenium is crucial for the production of thyroid hormones, and getting enough of it can help seniors maintain energy levels and support muscle strength. Just 1 or 2 Brazil nuts per day can provide all the selenium you need, making them an easy and convenient food to incorporate into your diet. Brazil nuts support healthy thyroid function, which is especially important for seniors who may be experiencing thyroid imbalances. Supporting muscle strength and coordination. In addition to thyroid health, Brazil nuts support muscle strength and coordination. Selenium helps maintain muscle mass and strength by promoting healthy thyroid function. Seniors with healthy thyroid levels often experience better muscle mass, improved coordination, and a stronger immune system. Boosting immune function. Selenium is also essential for a strong immune system. As we age, our immune function tends to decline, making us more susceptible to infections. Selenium in Brazil nuts help strengthen the immune system and protect against oxidative damage, reducing the risk of chronic illnesses. I've recommended Brazil nuts to many of my senior patients who have low energy or struggle with maintaining muscle mass. One patient, who had trouble with coordination and muscle weakness, started eating Brazil nuts daily. She soon noticed an improvement in her energy levels and strength, proving that small dietary changes can have a significant impact on overall health. 10. Pistachios, the heart and vision protectors. Pistachios are not only delicious but also offer numerous health benefits, particularly for seniors. They are packed with nutrients that support heart health, improve circulation, and protect vision. Regulating blood pressure. Pistachios are rich in potassium, which helps counteract the effects of sodium in the body and support stable blood pressure. High blood pressure is a common concern for seniors, and pistachios can help lower systolic blood pressure. Regular consumption of pistachios can lead to better cardiovascular health by improving circulation and reducing the risk of heart disease. Heart health and cholesterol. In addition to potassium, pistachios are loaded with healthy fats, including monounsaturated fats, which help lower LDL cholesterol and improve heart health. These healthy fats support better blood flow and reduce inflammation, both of which are crucial for maintaining cardiovascular health as we age. Eye health protection. Pistachios are rich in lutein and zeaxanthin, two antioxidants that help protect the eyes from age-related macular degeneration, AMD, a leading cause of vision loss in seniors. Maintaining healthy vision is important for preventing falls, improving coordination, and maintaining independence. Improving circulation and mobility. Pistachios also support circulation and muscle health. The protein and fiber in pistachios help maintain muscle mass, while the antioxidants and healthy fats promote better blood flow. This is essential for seniors who want to maintain mobility and prevent circulation issues. I have seen patients who were struggling with high blood pressure and poor circulation benefit greatly from pistachios. One senior, who had been on medication for high blood pressure, found that his blood pressure dropped significantly after he began incorporating pistachios into his daily diet. It was a simple change that had a powerful effect on his health. Conclusion: nutritious choices for seniors. As we've explored, not all nuts are created equal. Some can harm your health, while others offer numerous benefits. By incorporating chestnuts, almonds, walnuts, Brazil nuts, and pistachios into your diet, you can support your heart, brain, bones, and muscles, improving your overall health and well-being. It's important to be mindful of your dietary choices as you age, ensuring that the foods you consume are doing more good than harm. By making informed, healthy choices, you can enjoy a vibrant and active life as you get older.